All right. Well, I'll start. Just I've got to get things going, and so welcome everyone to the AVRC High Rounds. I'm afraid Dr. Blumenthal is not here this morning to host, so you've got me to introduce Dr. Lianne Urada. She's here to talk to us about homelessness at the San Diego Central Library, substance use, overdose, sexual exploitation, and other risks. Dr. Urada is an assistant professor of social work at San Diego State University, and she's an adjunct assistant professor of global public health at UC San Diego. She is core faculty for the SDSU UCSD joint doctoral program in interdisciplinary research on substance use. Her research interest focuses on community mobilization and collective impact interventions, addressing homelessness, sex trade and human trafficking, HIV and historical community trauma. She's got tons of publications on persons involved in the sex trade in the Philippines, Latin America, Russia, and the US. She was a recipient of a National Institute on Drug Abuse KO1 grant examining community mobilization and its potential to reduce HIV, STI risk and violence among substance use women in the sex trade in Tijuana, Mexico. Her current work examines solutions for the opioid and homelessness crises happening around US public libraries. She has NIMHD funding. She's also developing a historical community trauma measure in the East African refugee community in San Diego. She's licensed in clinical social work and with over 8 years of direct practice experience, in addition to all this research experience. So we're very lucky to have you today. And I know that people will be really interested in this topic. It's something that I think so many of us have experienced trying to solve and work with, and are often frustrated as well with our outcomes. So welcome, and looking forward to your talk.
Thank you. It's an honor to be here. Thank you very much. Actually, I am very excited to do this talk, especially with those at the AVRC in Hillcrest, because I heard the Hillcrest Library is facing a huge problem with overdoses there, just like this downtown Central Library. So I started my partnership with this downtown San Diego Central Library because actually I heard about the overdoses happening in the bathroom. There's a library, a parent that I met who is a librarian who told me about this situation. And so she introduced me to the head supervisor there. And this library has 100 staff, which I'll talk more about the context of this library. But so when I talking to the supervising librarian, even just recently, just within the past few weeks, she has been describing the different libraries she oversees in the city. And one of them is also the Hillcrest Library, which is having a huge problem. So just as background context, homelessness has been really rapidly increasing even before the pandemic, but actually during the pandemic as well, even more so. And if you didn't know, California has the highest number of homelessness, folks who are experiencing homelessness. So it's actually flipped around. New York has actually been doing a little better in recent years. But New York is also the second highest. And I'm going to the next slide. So I became interested in this, doing research on this topic, because I have been working in HIV for a very long time, especially in sex trade and human trafficking. And I also understand that with the homelessness populations and around the libraries, there's a lot of sexual assault and possible trafficking going on. So I was also investigating that, as well as the opioid crisis. So there's really just a lot of multiple risks that are faced by those who are homeless, and they're largely a hidden population. So I was very excited to be, I think, one of the first partners with this library and the libraries around research. And those who are experiencing homelessness, as you probably know, also just face a lot of barriers to accessing services, partially because they are kind of a hidden population and they may be just unaware of all the services. But also they have, they often don't have things like insurance and ID that poses even more barriers. In addition to there being stigma, them having problems with getting around, transportation to get to these services. So this all makes the library actually kind of a place of refuge for them, oftentimes in lieu of being able to access any other services. So the last time there was a homelessness count was January of 2020 because of the, during the pandemic, there was not one in January of 2021. And for San Diego, in terms of for San Diego, so there's a total of 7,658 who were counted back then. And as you can see, there's those who are chronically homeless, also veterans, families, and unaccompanied youth. Over half reports having a disability, many with chronic health, as well as mental health, physical health, and about a third having substance use. Relevant to the pandemic, however, there was a count of how many services were being used, and it was discovered that the first time homeless people count actually doubled in 2020. So the number of people who were first-time homeless as well as households doubled in 2020 compared to the previous year. So this is how much the pandemic has impacted this population. So this is a nationwide phenomena. There's actually social workers who are now starting to be, who are interning or working at libraries across the country. And at the San Diego Central Library, when I was doing this research back in 2019, so this was right before the pandemic, it was actually January to June of 2019. I saw that there were about 20 people, 20, 30 people every day before the library opened at 9 o'clock or 9:30. They would line up to get in, and many were facing homelessness, whether on the street or in the shelters, because oftentimes they can't stay in the shelters. So they all come to this library. But around 3,000 to 4,000 people actually enter the San Diego Central Library. And that this was pre-pandemic. Every day they have a tracker. So partly why libraries are attractive is because they're free and easily accessible. They welcome anybody in the public. The library staff are really trained to provide that safe, welcoming environment for everyone, regardless who they are. So I think partly that's why they feel so welcome here, even more so than going to other services where they might feel stigma going into those buildings. Therefore, public libraries are being recognized as having that potential place to assist individuals. And overall, the mission of the library is to be a place of opportunity, discovery, and inspiration. And so in my partnership with the library, I truly try to also align the goals, the research goals, with their goals as well. So one thing that they described to me was how that every day they would face this crisis of not only opioid overdoses, but mental health issues, people threatening suicide. Right before the pandemic, well, that summer of 2019, after I did this research, they had their first suicide that was completed inside the library. So somebody actually fell from the second floor to the ground floor. So it caused a lot of trauma, both among the staff and the patrons who witnessed it happen. Just in the past couple months, there's been actual overdose deaths in the library. So they reopened their doors, and in the bathrooms, people were overdosing, and they tried to revive somebody, and that person actually passed away in the from an overdose in that bathroom. And they have security who go around seeing if people are, asleep, or if there's problems in the bathroom. And even around the perimeter of the library, the security has also found people who've overdosed and who have passed away. So it's a huge issue that has really been gaining a lot of traction and attention with the library, and also with the city, getting city and county support. They actually are embracing a harm reduction approach, and they're all being trained to carry Narcan now. They're starting to, not just security, but also the library staff who are able to. So my research design, then I did focus on this one library, being the largest library in San Diego. And we did face-to-face, semi-structured interviews, in-depth interviews with 30 library patrons and 10 library staff. In addition, did 3 focus groups, one focused on women, one focused on people actively using opioids, and another with everybody. Also, everybody who received an interview also did a brief survey, which was really just a one-page kind of social demographic, but also some key questions that, in partnership with the library, we asked about some of the training needs that they perceived that the library, things that the library could offer as well. So altogether, there were 63 of those surveys, and 14 included library staff. So there's 100 library staff at this one library, but that includes everybody, not just librarians. Let's see. The recruitment was key, having a partnership with the library. So there were flyers that were posted and also passed around, and also at the front desks. And whenever I did a focus group, the library staff made an announcement over the PA system. So that really helped. And we have a consensus organizing center at San Diego State University in the School of Social Work. And so I used some of those principles of organizing, which is very much having partnership with different, with the community. In case you haven't been to the library, it's a really beautiful library. It's fairly new location. They rebuilt a brand new one at this location. The other one they vacated. And so just in the past, maybe 5 years, 5 to 10 years that this new library has been up. And there's 9 floors, and 1 floor actually is a high school, so it's off limits. What people don't always know is that on the, excuse me, on the 3rd floor, there's a homeless and mental health outreach office. There's also a veterans resource office. And then there's a host of other really offices that provide services, like a teen youth center. So they often have find youth who are might be sex trafficked there. There's a whole children's library on the 1st floor. There's some employment and computer training facilities. So the breakdown of those who I interviewed and surveyed, specifically the patrons, there were ages 20 to 70. And some of the stories I heard is there's some who are homeless who are even 90 years old. About half were male, a little over half were male, approximately half Caucasian, and then there's Latinx, African American, Black, and other. Majority were heterosexual. There's about a third disabled, either physical or psychological. 16% veterans. There were 63% were unhoused, meaning not in a shelter, and then there's 22% who are in a shelter, and others who identified as being in transit, such as couch surfing or being in an SRO hotel. And so in terms of the library staff, we also asked them about their educational needs and barriers of patrons, the training needs of librarians, and policy changes needed. So those were actually asked. Everyone received those questions about what the library staff could do. Some of the themes that I'll go over. So there's the human trafficking and violence against women, opioid overdose, the educational needs of the patrons and training for staff, recommendations and ways to help unstably housed. So in terms of the human trafficking, so women in a focus group, they said rape happens a lot on the street. Many attempt suicide or prison just to get out of the situation. I was really shocked at the situation for women downtown, because there was really just one dedicated women's shelter, and that one only accepts about 30 women, and then they would have, I heard reports of about 300 women who were going into their day center, but didn't have shelter. They were on the wait list. There are other shelters that do have women and families in them, but there's just that one dedicated one. So it was hard to find people who are actively being human trafficked, which often is the case, but there were definitely a lot of reports about people who had witnessed it or had experienced it in the past or suspected it going on. So for example, this quote says, we've had a variety of things. You often think it happens in far off places, but no, it's happening right under your nose. We have to be diligent to watch who's in our teen section. There's a sitting area right outside. You'll have full-grown men trying to engage kids. The youth are trying to just figure out their own life. Now they have this new trauma that's on top of all of that. I had a lady sobbing the other day out here. What I could piece together is she had been assaulted. When I was trying to offer her emergency, do you need any medical help? Do you want to talk to the police? She was convinced that wasn't going to do her any good because, hey, listen, I went through the court system, they screwed me over, or I was in the mental health system, and I mean, prostitution happening in the restrooms. And that's why no one can be in the family restrooms except for families. This was a library staff who was describing this encounter. And then a young male patron talked about also being an interstate trafficker at one point. I don't know what was in those vehicles, he said. Like him, other male patrons said they were constantly being approached by others. This is around the library, around the perimeter of the library, asking them if they want to make easy money moving people or things from one place to another. A patron alluded to the lack of being approached in the same way for legitimate work, where they can get a W-2 and not always having to hide and look over their shoulder. And he also said that men are even solicited for sex more than women at times. So this is around the downtown San Diego area. Two different female patrons described a male who hangs around here outside of the library. He's always trying to pick up girls. And they said they even went to his house, which was in one of the luxury apartments nearby, like a one-bedroom apartment. He had 2 bunk beds in the living room, which was a very small room, and then another bunk bed and a futon in the living room, but he had 2 bunk beds in a bedroom. And according to him, there were 6 women in him. Then we heard horror stories about him taking 2 younger girls around their 20s and never seeing those girls again. So that guy's not reliable. And we also told the staff, they talked to him, and now he's not allowed to be around that library because he had done some bad things. Also, just outside the bus stop, they heard stories about a dude always shows up and he's telling the girls, oh, you can get a job working with me, cleaning a trailer, this and that. I'm looking for a house cleaner. This might have been even the same guy, but these were different reports from different people. And told me that 2 girls went with him and that she never saw him again. My friend was talking to me. He went up to her, was just making general threats. I backed away from him. And I knew, I was like, he's looking for people to take and he's targeting people, the women from that women's shelter. Does the shelter know? A library patron said a lot of violence and sexual assaults occur that people are not aware of because women just remain silent. They're afraid of retaliation by the perpetrator, like sexualized slavery. So women residing on the streets reported sexual assault, verbal harassment, unwanted physical contact compared to those living in the shelters. A female respondent shared accounts of being harassed in her sleep. I get people that will come up and like be touching on me while I'm asleep, and I'll wake up to that. Another female said that predators and offenders lure women through prospects of a job or safe shelter. So because they're homeless, they're trying to approach them and say, oh, there's a cheap room for rent. And I've seen people get kidnapped, mainly women. They just take them and you don't see them again. I mean, these women are lost in drugs and nobody looks for them after that. And then a female respondent who had been using substances. So she was forced and deceived into exchanging sex for money, stating that offenders look for certain characteristics, such as women using substances. Most of the time, the predators will try to find somebody who's already hooked on any kind of drug. Women shared a personal experience of being sexually assaulted while living on the streets. She had been deceived by a friend who had given her an adulterated drink. Shortly after, she lost consciousness. I woke up under the bridge over that way towards the Coronado Bridge, and there was this big old guy next to me. I had bruises up my arm and it looked like needle marks. I don't use needles. I woke up like nude from the waist down. My student and I, my doctoral student in the JDP substance use program, she published this article on polysubstance use using the data from the study. If I don't take care of my heroin addiction in the morning, like I get sick and then it's hard for me to do anything throughout the day. So I try to take care of that first. So interestingly, those who were homeless felt that they needed to take care of their withdrawal symptoms in order to get through the day to take care of all of their other daily needs, just them getting around, moving their belongings around, etc. So some of the barriers that the subgroup of those who are using substances, about a third of the study, said that lack of insurance, being unable to afford out-of-pocket expenses, limited options, even with insurance, there's being long wait lists. Those were all barriers to their recovery. So for example, there was a 24-year-old male using opioids who couldn't get into the sober living facility because he tested positive, even though he hadn't recently used. And so he ended up staying homeless and returned to using. There was a focus group we did just with those who were using opioids who described the same thing. They couldn't even get into detox. They didn't know where to go without the right insurance, without having to go far away outside of the downtown area. Then a 47-year-old veteran who used opioids while on the wait list for VA housing, he began using again. And so then it also created a barrier for him to get into housing. So this kind of speaks to that need for that housing first model, which I know the new mayor is really on top of now. Participants, about 12 of them, also worried about Narcan, that it would cause attention to them and they would become involved in emergency services. Also that it ruined their high, of course, and it caused immediate withdrawal. Of course, fentanyl is a big issue, and in the focus group that I did with the 7 who were actively using, there's one who had just taken fentanyl, and the others were asking where they could get it to. And that one actually wanted to get into treatment, but didn't know how. So in terms of the brief surveys, the question about what are the educational needs of the patrons themselves that perhaps the library could help with. So nearly 1 in 4 patrons and 1 in 3 librarians actually said that they would like to know more about HIV and other health issues. Other health issues being regular testing, blood pressure, nutrition, other STIs, hepatitis A, because you might have heard a couple years back with the huge hepatitis A issue outbreak among those who are homeless downtown. And then also they said human trafficking, substance use recovery, access to electronic devices, financial assistance for education. These were all things that they were definitely interested in. In terms of policy changes that they felt were needed. So having a social worker in the library, 69% of patrons, 93% of librarians felt that was needed. Of course, shelter and housing availability, substance use options, treatment by police or others, policies for formerly incarcerated. And also just the mental health needs. A majority also described that, as well as substance use recovery. And then specifically the training needs of librarians. So 59%, 51% of patrons, 50% of librarians said how to identify, detect, intervene with human trafficking, but also they felt similarly, they needed help with substance use issues, mental health issues, again, with the HIV or other health conditions. Interesting, is a little bit lower. The librarians said 29%, but probably they're dealing more with mental health and substance use and not as aware of all the health conditions. But the libraries actually said the county or city was going to try to place a public health nurse or a nurse in the library. So hopefully that is coming. In terms of ways to help those, another priority was providing peer support and outreach. So the patrons, 71% of the patrons who took the survey said they're interested in attending a peer leadership training, because I'm really interested in community mobilization, and they also really expressed how valuable it was to have someone with lived homelessness experience as peers, as advocates for them. And the majority gave their follow-up information in order to, in case that were to happen. So if there's an opportunity for their voice to be heard, I think that a lot of clients would take that because they're not given that platform very much. They're not granted autonomy in virtually any circumstances. So any situation where they do have that choice is huge. Another priority of the library is to connect them to knowledge and each other. So oftentimes they're falling into routines of survival, such as moving and protecting their belongings. They need storage, hygiene access, transportation, computer literacy, just needing to know where to find a safe place on the street to sleep, finding resources from each other. So, and I have some of my colleagues, especially at LCSW, who are doing some research around the hygiene access and increasing that. But the majority of the patrons felt access to more better equipped shelters and housing options was needed. So it's, having that, the wait list, there's so many that they had to sleep on the street because they couldn't get into the shelter for oftentimes weeks. And a lot of further trauma happens the longer they are on the street. Okay. So a quote is, these resources, I mean, it's one thing to hand somebody a paper with a bunch of resources on it, but sometimes you need somebody to actually walk with you and take you there and help you go through the process. So another thing is, if they are homeless, they get a job, but they do not have anywhere to put their stuff. They would get a citation for being homeless, sleeping somewhere where they're not supposed to, then showing up for court was an issue because they couldn't bring their stuff to court. Even in the library, they have to keep their belongings. If the bag is too large, they have to keep it outside. But the library does give them some places to sit by the window so that they can look down at their belongings. So this is a big issue because there might be resources, but oftentimes the navigation of it, just knowing how to fill everything out on the computer, they often need assistance, and the library staff can, have had to do some of that, but they would really like social worker there in the library. So training library patrons and staff on HIV, health, mental health, substance use, and other critical issues are important, but at the same time, it's hard for a librarian to take the place of a nurse or social worker. So having a permanent library social worker is important. We have placed interns there and are currently trying to place interns there now. But again, having someone there full time, I think helps. The county has placed a licensed clinical social worker in the El Cajon library, and they're trying to measure how that is working out. But there's, again, these funding issues. So the National Alliance of Mental Illness, they are housed at this library full time. So they just started doing that right before the pandemic, having a single agency there who can be there consistently every day. So that was working out really well. And I think some of these outreach workers, they're mainly doing outreach, but also connecting them to housing and other resources. I think that one was being trained to be a social worker. So that's something promising as well. But there's a long ways to go to eliminate some of those substance use treatment barriers, and also the sexual violence and safety risks around the library. So one thing that I submitted back in this last October was this grant, R21 NIDA grant, called BOOP by the Book, Developing and Testing a Telebuprenorphine Intervention in Public Libraries with Unstably Housed Persons with Opioid Use Disorder. So some of my co-investigators are Dr. Carla Menfeld, who's an addiction psychiatrist at UCSD. Also Stephanie Strathby, Peter Davidson, Richard Garfien, Eileen Pipitan, and Mari Zuniga. And so it's not getting reviewed until May. So in the meantime, this opioid crisis is happening, but the hope is to pilot this telehealth intervention in the library in partnership with Father Joe's, who would be delivering the telehealth to them. But the patrons would just have to access the telehealth in these library rooms that they privately can reserve, as well as there's a huge digital divide emphasis that the library is trying to address. And so they have been giving out laptops and computers to everybody. So they were very enthusiastic about this proposal. So we're really hoping that we can do this. And NIDA was also enthusiastic, but we'll see how the reviewers, what the reviewers think. And then in the meantime, we're trying to place the social work interns there. And we do have an agreement with the city, and it's just a process. But San Diego County is also very much enthusiastic about addressing homelessness right now, so they were also supportive of these efforts. Okay, I noticed there's a couple of chats maybe that I'll take a look at next. The funding, I just had some small pilot funding to do this research I described, which was from San Diego State University, Social and Economic Vulnerabilities Initiative. One of our, we just won a Big Ideas Award at San Diego State to address homelessness. And then also my KO1 award, I'm acknowledging that support, which I just wrapped up this year. And I involved many students, many graduate students, and also the library staff, my partners. Okay, I'm gonna stop share and.
Thank you so much for that, Dr. Urada. And yeah, just going, that was fascinating. I'm sure there's gonna be loads of questions. Just drawing attention, as you mentioned in the chat, there was something from Dr. Aldous asking about essentially HIV Hep C testing in the library, but I guess that relates to any medical services that are available to people at the library.
Right, yes, so they do have fairs occasionally, that not every day, but an annual fair that they try to it could be a health fair focusing on the population that is homeless, because somewhere upwards of maybe even 80% of the patrons, people say could be homeless. It's just really hard to get the exact prevalence there, but so they are recognizing that, and they do that. But so they do, I believe, family health centers, maybe even at this Hillcrest library is active in doing some things like the COVID testing, but also some other screening and testing. So they very much welcome it, but they don't have actual hired staff. They use community partners who are willing to come and do those kind of things. So HIV testing, no, it has, as far as I know, it has not been done. And I thought about that, and I'm wondering, how much prevalence we'll get, but I have thought about that. How close is the library to the needle exchange program downtown? Is there a partnership between the two? There is a mobile van that comes around, I believe Tuesdays and Thursdays. That's very near the library, so they often access Narcan and do needle exchange with that mobile van. So that's the one I hear about more than an actual needle exchange program that they go to. And the library is actually going to be offering Narcan in the library, carrying it and offering it. They're really trying to look at ramping up. They actually use the term harm reduction. And the library was kind of cute. The librarian overseeing the place actually said, okay, she heard about safe injecting sites, and maybe the library could be one of those. I said, well, in the country that hasn't really been approved even, and so I'm not, I doubt that the library would be approved as a site, but now they really are trying to do harm reduction, and so we'll see. So Dr. Aldos is saying, very interesting work. We can't make progress without tackling meth. Yes, wish we had better resources and treatment offices. Thank you. It says, thank you for, it says, recent article gave a nice description context to the meth crisis. And so she shared that. Thank you. I'll definitely take a look.
Yeah, I tend to, hi, this is Nettie Aldous. I tend to, in these talks, always try to loop meth in, because we have the focus, I think, on opioid because we have treatment. But obviously we need to do both, but I think most of us see so much more methamphetamine and so connected to homelessness, and really just I think it's the #1 challenge facing me in our practice at St. Isidro Health and in our HIV population is really this crisis of methamphetamine that has exploded even more so in the past decade. So yeah, I'm always wanting to try to link the great work being done in the opioid crisis to the methamphetamine opportunities for treatment.
Thank you. Yes, I totally agree. There were reports of fentanyl also being in meth, or people overdosing from meth in those stories. So yeah, I think that sometimes the attention on meth is not as great because the East Coast wasn't experiencing it as much as the West Coast, where the funding is.
Hi, Lianne. Thanks for your wonderful talk. It's nice to hear about you know, what's actually going on here in San Diego in the libraries, and you know, I don't think that we've really hear too much about this type of information. I did some work at the San Diego County Jail for many years. We were contracted to take care of HIV patients there, and I know that many of our patients would oftentimes, after getting out of jail, go straight to the library to try to access internet or whatever, to try to do you know, to take care of whatever needs they had. And you know, it seems like it's a great place to do much more research, you know, as there's obviously quite a few different problems. I work with the AIDS Education Training Center, and we do trainings. And so if you're interested in collaboration, I can put my email down, and we can do trainings, certainly HIV, Hep C, those kinds of things, if you're looking for collaboration, or if, you know, if you want to pass on a resource to the library staff, we can probably help with some of the training needs.
That would be great. Yes, thank you. Please do put that in this chat.
Sure.
The Hillcrest library, I did look into, when I was doing the grant, I was trying to see if there's anyone who gave same-day buprenorphine, and it seemed like the UCSD hospital only gave it like a one dose, so that wasn't quite enough for me to follow up on. And then I think Family Health Centers has patients wait 7 to 10 days before getting buprenorphine. So I was looking for that same day model that Father Joe's had. And I don't know if San Isidro Health Center, if what the policy is for buprenorphine treatment. But if I end up...
We don't have a policy that I'm aware of, but we do have a substance use disorder clinic and open access to it. I don't think they have any required waiting period, but I'd have to ask them.
That's great. Okay. For AVRC, I was wondering if you have encountered this since you're near the Hillcrest Library. This issue of homelessness or opioid overdose, substance use overdose. I'm sure meth is also a big issue, struggle, right?
I mean, not at the AVRC, but when I worked at the ER, that's actually the reason I left the ER, is because the homelessness and the drugs and everything was getting as bad as it is, and that was 4 years ago. So it's a very big problem at UCSD.
Oh, okay. Yeah.
Sorry, I didn't say that very well, but I think the Hillcrest ED is doing more. I don't know if Laura can speak to it better. I think she's in more conversations and other people besides me But I know this is something that they've been working on quite a bit. But I think as everyone keeps pointing out, our bigger issue is meth. And that is, more difficult to deal with and don't have the same treatment options.
Yeah, because the library in Hillcrest, I think because of the proximity to the ER, they have so many people who come out of the ER and then go to the library there. Yeah, in terms of volunteer opportunities, so the library system has kind of a process that people have to go through to volunteer, where they have to be matched and everything, but going through affiliated programs like NAMI, might be another way to do volunteer work, and definitely can contact me. I'd be interested to hear more, because we could probably use some too. Hopefully we get funded to do things more in the future. Let's see, sounds like a library RN clinical outreach office with testing would be useful. Would be great to look at collaboration options. Yes, so yeah, so so Father Joe's and family health centers. So I've been talking to them in the past, and but not so much around the HIV. So that's a good idea. I know there's a priority to try to find those who haven't been tested, and so this might be a good way. I guess I hesitated to put in a grant for it, because I'm not sure what the numbers will be, since our numbers are lower in San Diego for HIV than other places. So if there was this big HIV testing at the library, I'm not sure what will yield, but I think it's.
Well, with COVID, I will say that, this is Nettie again from San Isidro. I will say that through my work with the county with COVID and COVID vaccines, and then tuberculosis, and there's sort of this desire to stop compartmentalizing all these different diseases and try to bundle our outreach and services. So we already have very successfully done that with HIV and hepatitis C, right? Nobody would sort of say, oh, we're only going to touch you for HIV, right? We do HIV and hep C. And then with COVID, it's sort of people are realizing, maybe we can sort of bundle while you're waiting for your vaccine, you get your TB screening and your hep C and HIV screening and things like that. And so when you have a population like this, that's pretty, has a number of different combined risk factors, it's a nice opportunity to layer that on. And especially right now with COVID, there's kind of a lot of motivation for public health outreach, improvement, and access to public health services. So you can do a lot of lumping together, like, oh, we need a vaccine clinic, and while you're here, let's do your HIV and your hep C testing. So I think there's opportunity right now in infectious disease prevention for us to sort of combine all of our efforts and messages. I'd like to tack tuberculosis into that, but there's all these diseases that are off to the side, and we could put them together and be more effective.
Yes, and those who are homeless are at so much higher risk for everything, right? And those using substances, the infections that they have, they get really high.
I had a two-part question, and that is the population of homeless people at the library a more consistent, or is it very transitory in terms of the people that are there? And that sort of links into provisions for them. If it's a very consistent population, then it's a good location to sort of do continuous healthcare. And secondary, I think of libraries as a place of sanctuary, and I don't know if that applies to everyone. And I wonder if perhaps outreach efforts would have better outcomes for people that are seeking or presenting to libraries or places like that. And I wonder if there's any evidence that you've come across that shows that.
Yes, I think this is a great opportunity to find those who you can't usually find, because it is such a sanctuary. So that's what I was trying to get at but in terms of the wait, what was that? The first question you had, where was that? What was that?
Whether the population is very consistent. Is it
oh,
the
right,
same,
consistent.
Is it the
yeah,
same people coming all the time, or is it sort of transitory? They'll sort of come and then disappear again from that area.
Yes. So, well, it's consistently high that people who are homeless that go there, but in terms of how long they're around, it could be 3 months, more transit in that way. But there's others, for example, there's many from living in the shelters who come, and some of them stay for months or a year. So those would probably be more stable, the ones who are coming around. But the ones on the street, they, I've heard maybe like 3 months is typical. Yeah, that 3,000 to 4,000 who go to the library daily. That's everybody. So that's the clicker when people walk in and out. So there could be some duplicates, but still quite a lot of foot traffic that's gone through. And because of COVID, they have been very careful and were shut down for a while. But then as soon as they reopened, all of these crises were happening again, and with less staff, by the way.
All right. Well, any further questions? But if not, thank you so much for your time. We appreciated that very greatly. I'm glad to see that Dr. Blumenthal is getting better as well by getting in there for some questions. There's lots of thanks in the chat for the great talk.
Yes, thank you.
All right. With that, have a great weekend, everyone, a great day. We'll take it from there.
Thank you. Thank